Okay, here's a great dynamic balance exercise you can do with your patients in OT or PT. And we do not always need expensive equipment. We can use a broom. So you can do this in the clinic or at a patient's house very easily. So first of all, you can do different foot positions. Right now, Nicole is in a wider base of support. Or you can change it and do a more narrow base of support. You can do semi-tandem. You can do tandem. All different levels as you progress, and make sure you document that in your notes how you're progressing your patient with different bases of support. Now to progress this activity even more, we can have your patient reach for different colors too. So we call red, yellow, green, whatever color out of order. And we can step and reach, which she was just doing before. Step and reach to different colors. You can go in order, you can go out of order, however you want to do it to progress your patient, and then just document how your patient is progressing. You could say they start in wide base of support and they have progressed to tandem base of support. They progressed to taking a step and reaching, which also helps with coordination, step length, shoulder range of motion. We can do it sideways. More of a sideways step and reach so we can get those different planes of motion in there. We don't want to do everything in one plane. We need to change it up. And it also gets the obliques. As you saw, you could do it in static, or you can add the step to the side or to the back. This is a great way to get some hip extension, core stability, coordination. And don't forget, we also have that grip strength on there. We're grabbing the broom. And we can go around in a circle as well. So we can really work those shoulders. So this looks really good, Nicole. And then don't forget when you're documenting, make sure you are documenting the skill you're providing during the activity and how the patient presents. For example, if your patient loses their balance while reaching outside of their base of support, what did you do to correct them? Did you stabilize them at the hips or instruct to increase their stance? What did you do that a caregiver could not do? Were you giving tactile cues at the shoulders? Were you giving tactile cues at the core for stability? Were you having them take an increased step length? Were you having them reach further out of base of support when they're actually sweeping that? Whatever you did, make sure you're documenting it. Make sure you're documenting the progression and make sure you're documenting the skill that you provided, that the patient could not do this activity without you. Subscribe for more engaging, patient-centered activities with documentation examples. See you later.